Effect of stress. All kind of stress or trauma deplete body storage and interfere with ingestion, digestion, and metabolism. Injury, accident, trauma, burns, cancer, illness, fever, infection, loss of blood and other body fluid, loss of body tissue, and other conditions requiring surgery can significantly deplete body substances in a patient. Such injuries and stress require an increased amount of nutrients for repair. These problems are usually compounded by psychological stress such as anxiety, fear, and pain, which greatly interfere with the desire or ability to eat. During periods of stress, there may be reduced function of gastrointestinal GI tract, muscular activity is lower in the digestive tract. This may cause abdominal distension, gas spasms, and constipation. In some cases, the nervous system may be stimulated by the condition, resulting in nausea, vomiting, and diarrhea. Prolonged stress require prolonged stress results in depletion, liver glycogen, and the wasting of muscle. There was the effect of nutrition. Good nutrition practices lead to effective wound healing, increase resistance to infection, shorten convalescence, and lower the mortality rate. If you have a poor nutrition, this will serves lead to a poor wound beds, wound healing, dehydration, edema, excessive weight loss, decol- decobitis, ulcer, increased infection, potential liver damage, and high mortality rate. Now, today, if we see this needed for surgical experience, if number one is a protein is needed to build and repair the damaged tissue, number two is carbohydrate and fat are needed to spare protein and furnish energy. Spare protein and furnish glucose is necessary to prevent acidosis and vomiting. Using vitamin C is requirement to hasten wound healing and collagen formation. Vitamin B is complex needed to form the coenzyme for metabolism, especially of carbohydrates. If you see the vitamin C is needed to promote blood clotting. Vitamin K is needed to promote blood clotting. If we see the minerals like the zinc is needed to add wound healing, iron is needed to prevent hemoglobin synthesis plus blood loss. You're gonna see this. Okay, pre-operative nutrition. The, the undernourished patient because of lack of the major nutrient necessary for recovery is at higher risk in surgery than a patient of normal weight. Protein deficiency is most common among these patients. Okay, in pre-operative, the protein deficiency is most common. Among these patients, low protein storage will predispose the patient to shock. Shock can occur, less detoxification of the anesthetic agent by liver. Anesthetic agent by liver is very low. Increase edema at the incision site and decrease antibody formation. The lost factor increase the risk infection. If we see the intravenous feeding of sulfonate and more concentrated in nutrient prior to surgery is one way to replenish nutrient storage. Now, obese patients are high risk in surgery than those of normal weight. Excess fat complicates surgery, put a strain on the heart, increase the risk of infection in and respiratory problem, and delay healing. The risk of disease and evaporation, ever, evisceration are higher in the obese patient. Pre-existing conditions such as hypertension and diabetes, which are prevalent in obese patients, are also increase risk. There is no quick way for our obese best person to safely lose weight prior to surgery. If time permit, a local diet highly essential nutrition should be attempted. Starvation and fair diet obviously not recommended appropriately. After surgery is not in the patient's best interest when the need for all nutrients is high. If weight loss is needed, low-calorie diet should be instituted until healing is complete. The pre-operative diet for this patient should be rich in carbohydrate, protein, mineral, vitamins, and fluids. This diet will assist in rapid recovery and promote wound healing and decrease the risk of infection and other complications. If patient has a pre-existing condition, for example diabetes, the blood sugar should be stabilized before surgery. Okay. Other problems such as anemia, dehydration, acidosis, or electrolyte imbalance should be corrected before the surgical procedure. You can see this post-operative nutrition, energy, protein, and ascorbic acid are major factors in achieving rapid wound healing. Fluid plasma is another major concern. Mineral and other vitamins are support vital recovery. The post-operative diet may be liquid, soft, or regular consistency. It must be high in calorie, protein, vitamins, mineral, and fluid. Okay, the post-operative diet may be liquid, soft, or regular consistency. Must be calorie, protein, vitamins, minerals, and fluid. That was the rationale for diet therapy. If since 100 to 200 gram of high quality protein powder are needed, up to 1 pound of tissue protein powder may be lost through bleeding. Hymen will require using protein foraging for exude and catabolism muscle tissue as well as from surgery itself. Plasma protein loss from hemorrhage and wound bleeding may occur. Loss of plasma protein and blood volume increase the risk of shock. Extra protein is required to replace these losses. Fever and inflammation that may accompany with surgery can be reduced by increased supply of protein. When antibody production decreases, infection increase. Okay, when antibody production decreases, infection increase. A high protein intake can reduce risk of infection. Edema may develop due to imbalance of colloidal colloidal osmotic pressure. Serum protein level must be increased to reduce edema. Edema at the incision site may be also developed, showing healing. This is another reason for protein intake. If the bone healing is delayed, if the protein intake is not high, bone healing is delayed and protein intake is not high, the bone marrow is considered a special protein that anchor mineral and ferrocalcification. Now, hormone, enzyme, or protein substances, a lack of protein can lower production of these vital substances. In the liver, protein combined with the fat for removal. Protein combined with fat, this prevents fatty infiltration, thus increased protein can protect the body against liver damage. When a protein combined with the fat, the product is lipoprotein. Now, what is the fluid? Fat fluid. There must be sufficient fluid to replace potential losses from vomiting, fever, diuresis, drainage, and exits. Preventing dehydration of great importance is of great importance. Up to 7 liter fluid powder may be needed because the body tends to retain sodium fluid post-operatively. Total fluid intake and output must be measured and recorded to ensure proper fluid balance. If the caloric intake in post-operative patient is inadequate, protein will be used for energy rather than for tissue rebuilding and wound healing. More than half of the ingested protein will be used to provide energy in the absence of sufficient carbohydrate and fat. A minimum of 2.00 calories per day from carbohydrate and fat must be available to spare protein for its primary purpose. Canals, if protein for tissue building and repair, the total calorie counting of the diet should range from 4,000 to 6,000 calories. Okay, 4,000. If it's a vitamins, vitamin C availability is imperative. The role of vitamin C is also supply the cementing material of connective tissue, capillary wall, and new tissue. Depending on the nature and extent of the surgery, the patient may need 6 to 20 times earlier derived vitamin K, also especially concerned because it functions in blood quality. Intestinal bacterial synthesis of this vitamin is decreased because of use of antibiotic and elevated demand will reduce proton formation, which can be corrected by the presence of more vitamin K. Vitamin K, the need for B-complex vitamin increases with rising caloric requirement. These vitamins function as coenzyme in carbohydrate and protein metabolism, the formation of hemoglobin and prevention of anemia. Now if you see this minerals are great importance in the replacement of electrolytes, stimulatory loss with the fluid from the body. The amount of